Hi, I'm Dr. Deborah Legge, and I'm the video therapist. Today, I'm going to answer your question about what is borderline personality disorder. Borderline personality disorder is a disorder that is diagnosed by some psychiatrists, mental health clinicians, and health professionals. Sometimes, in this day and age, people will go out on the internet and they'll take lots of psychology tests and psychological tests that will give them a diagnosis here or there. And they may come up with their own diagnosis of borderline personality disorder. Wherever the diagnosis comes from, lots of the stuff you read on the internet, a lot of the things that you read in print have a real negative view of borderline personality disorder. And it can be very frightening to read these things, especially when you don't know what you're going to do about it. So I'd like to explain it today the way I would explain it to one of my clients face to face, sitting in my office. Borderline personality disorder is not a death sentence, okay? When people are experiencing borderline personality disorder, they're usually having a pretty tough time in their lives. They're usually having problems in relationships. They're having problems at work. They're maybe having problems at school. But usually there's a whole lot of internal turmoil, and people with borderline personality disorder, or BPD, don't feel very good about themselves. The way I try to explain it to people with borderline personality traits or borderline personality disorder, or people who are support people of people with BPD, is that borderline personality disorder is just a different way of looking at the world. For some specific reasons, perhaps in growing up, you've needed to learn how to manage the world a little bit differently than others. You had messages in your childhood that led you to manage your world a little bit differently. And it may have worked through adolescence. It may have worked through your early adulthood. But now that you're a full-fledged adult having to manage in the day-to-day world, it's getting to be a little bit more difficult. People with BPD tend to have problems in different areas. The first being interpersonal effectiveness. It's usually difficult to maintain relationships. You may find that you're doing really well in a friendship, and then all of a sudden the person either checks out or you've had enough. You might get bored. You may notice that in your relationships you do a lot of pushing and pulling. You push and push and push, and when the other person responds and pulls back, you say, I'm sorry, I didn't mean to do that, or say that. There may be intense fears of abandonment or rejection. You may just live in fear of the next time someone's going to leave you. The interpersonal stress and distress can be so great that it's difficult for you to sit with. Being able to sit with that internal distress without acting on it might feel impossible. You might have to pick up that phone for the 20th time. You might have to send that 50th email just to make sure that the person heard your apology or heard what you had to say. Sitting with that turmoil seems impossible. Yet when you act out, other people get frustrated, and it makes things so much worse. You may have trouble determining what you're feeling or what you're thinking, especially about important things. And I mean really important things, like, what do I want to do for a living? What is my sexual orientation? What's important to me? What are my religious beliefs? Those things may not seem solid for you like they would for other people in your age group. A whole lot of uncertainty about big things. You may find that emotionally you're either at 0 or 180. That you can just shift your mood so quickly, and they can be so severe and significant that people are almost shocked at how quickly you can change your mood. You may be doing very well, and the next minute you're very, very angry. You may have angry outbursts. You may get violent. You may get so frustrated and maybe not know what you're feeling that you may be doing some self-mutilation, like cutting or burning or banging, unsafe sex, addictions. Those can be part of borderline personality too. Not always, but sometimes. You may have a really hard time feeling strong standing on your own 2 feet. You may not know that no matter what, You'll always land on your own 2 feet. You may not be sure of that. So it makes you feel uncertain, and it makes you feel even more vulnerable to your fears of abandonment and rejection. You may be extremely hypersensitive to what others are thinking or saying about you, or what you think they're thinking or saying about you. And that hypersensitivity is difficult for you to sit with without acting on it. So that's pretty much the cluster of symptoms that we look at when we talk about borderline personality. But there is help. Many people experience borderline personality traits. Many people do. And there is help. Most people now turn to a type of therapy called dialectical behavior therapy, or DBT. It's found to be very effective. I've been using it for many, many years in my own practice with clients with borderline personality traits. And I use it also for people with chronic depression, because people with borderline personality tend to have anxiety disorders or depression too. So you can reach out. You can do some reading. There's not a whole lot out there, but you can do some reading and find out, a little bit more. But I would encourage you to contact a mental health professional who specializes in treating borderline personality traits, especially if you can find somebody who does work with DBT. You may find that that individual counseling or group counseling experience with DBT is going to be just a life-changing experience for you. You may find that in learning healthy skills about feeling strong within yourself, feeling certain about who you are, being more interpersonally effective, being able to sit and tolerate your distress without acting on it, you may find that those skills might be just what you need to make all the difference in your life. So, good luck to you, and I hope to see you next time.